Good afternoon, everyone. On behalf of YWCA Edmonton staff and board of directors, I want to warmly welcome you to our Power Lunch series. My name is Amber Niemeyer, and I am the Director of External Relations for YWCA Edmonton, located in Edmonton, Alberta, Canada. Before I begin, I would like to respectfully acknowledge that YWCA Edmonton is located on Treaty 6 territory, a traditional gathering place for diverse Indigenous peoples, including Cree, Blackfoot, Métis, Nakota Sioux, Iroquois, Dene, Ojibwe Anishinaabe, Inuit, and many others whose histories, languages, and cultures continue to influence our vibrant community. YWCA Edmonton has been proudly serving and empowering women and families in the Edmonton region for 113 years. Through world wars, the Spanish flu, and many other trying times, we've always been there with a helping hand. And so COVID-19 has been no different. We're hard at work helping vulnerable women and families in our community get through this crisis and ensuring women's voices and perspectives are at every decision-making table during this unprecedented time. The Power Lunch is also part of our COVID-19 response plan. While we may not be able to gather in person, it's important now more than ever that we come together and engage in powerful conversations that spotlight Canadian women doing remarkable things to make our world a better place. Our virtual Power Lunch speaker series, which runs until July 14th, features 5 brilliant Canadian women that we think you should know and celebrate, including award-winning authors, diplomats, and women's rights activists. Today, we welcome Maya Roy to the Power Lunch. I'm so happy to see your face. Maya is CEO of YWCA Canada. She has spent her career working as a diversity specialist to support human rights and violence prevention. Maya will be making a presentation today about what a feminist approach to Canada's COVID-19 response should look like. It will be followed by a Q&A session. We are also joined by 2 moderators, YWCA Edmonton board members Rebecca Lee and Marina Bannister. Rebecca has a background in people resources, culture, and leadership development. She is a senior manager at ATB, transforming purpose to performance and building a talent network for the future. She is passionate about connecting people and sharing her nonprofit experiences and advocating for the equality of women and girls. Rebecca serves as Vice President of the YWCA Edmonton Board, and she looks forward to contributing to the diversity and inclusion conversations in our community. Welcome, Rebecca. Marina Bannister is currently a consultant at the Canadian Strategy Group. She is a communication and government relations professional who is passionate about increasing political engagement. Just ask her, she'll tell you. She serves on the board of YWCA Edmonton and YWCA Canada, where she volunteers for advocacy expertise to support women, girls, and families. So with that, please grab your lunch, everyone, and prepare to be inspired. Rebecca and Marina, over to you.
Thank you very much for that warm introduction, Amber, and it's absolutely my pleasure to be here today introducing Maya. As Amber mentioned, Maya will be speaking until about 12:25, and then we have lots of time for questions after that. If you have a question during the session, please use the Q&A box, which is at the bottom of the Zoom screen. You can also upvote the questions if you really want to see it be answered, and that will help make sure that Maya sees that question and we can get to it. Maya is also going to be using some polls during her presentation that we can all participate in, and that will be an engaging way so that we all get a sense of how the community that's on this call is reacting to the presentation that Maya is giving. So Maya Roy, as Amber mentioned, is the CEO of YWCA Canada. Maya is a diversity specialist with 22 years of experience in a variety of sectors in public policy development, public health, adult education, and social work. Her work has taken her to Thailand, Brazil, India, and the United Kingdom, where she's worked with NGOs to support human rights and violence prevention. Her essays have been published in Going Beyond the Journal in 2013 by the Insomniac Press, and she's the winner of the 2013 CASSA Gender Advocate Award and the Toronto Community Foundation's Vital People Award in 2014. She has a Bachelor of Social Work from the Ryerson School of Social Work and a Master's in Social Policy and Planning from the London School of Economics. Maya was a member of the Gender Equality Advisory Council for Canada's G7 Presidency. She's currently part of the Young Global Leaders with the World Economic Forum and sits on the board of the Women's College Hospital. I also have the pleasure of sitting on YWCA Canada's board, so I can personally speak to Maya's amazing leadership. And without further ado, it's over to you, Maya.
Thank you so much, Marina. And thank you again, Amber and Rebecca, and to Catherine O'Neill and the whole team at YWCA Edmonton. I cannot tell you how exciting it was to get this invitation, but just how overwhelmed I was to see my name on the list of the other women who are coming to the power lunches. I see myself 3 years from now being able to fangirl Tanya Talaga and say, oh, we were on the same list 3 years ago, thanks to YWCA Edmonton. Very pleased to be here today and talking about, and also hearing from you around what could a feminist recovery from COVID look like. It's been a very challenging 4 months, and that's also why I really appreciate all of your time and people coming to this call. I know many of us are zoomed out. We're going from Zoom call to Zoom call. So again, very much appreciate your time. Just before I get started, also thank you again for the wonderful land acknowledgement for community members on Treaty 6 territory. I'm very privileged to live and work and play on the lands of the Mississauga of the New Credit Nation. So very pleased to be here today in Toronto and being able to speak with all of you. So just before we dive into the slides, I thought we could do a little icebreaker. So I had mentioned, 3 years from now, I see myself fangirling Tanya Talaga when I ask her to sign my book. But also wanted to ask everybody in the audience, what's the first thing you're going to do post-COVID? What are you looking forward to? What are you excited about? So if you're interested, please dive into the chat and just send me a little, what's the very first thing that you're going to do? My worry was that I'm very proud auntie to 2 children, 7 and 10, Anya and Elijah. So I was really worried I wouldn't be able to hug them for about 3 years until we get a vaccine. But wanted to ask people, what's the first thing you're thinking about doing? Because a lot of what we're going to be talking about today is looking at what's happened over the last few months, but how do we want to move forward? And what kind of future do we want to build for ourselves, our families, and our communities? So maybe with that, I can dive into the slide presentation. Thank you very much to Christine. Thank you. So really what I wanted to talk about today is take a little bit of a high-level bird's eye snapshot. My colleagues at YWCA Edmonton and at the YWCAs across the country have been doing incredible work over the last 4 months. But that's also given us a bit of an opportunity to think about what can we start to do in the future. So next slide, please. So for us at YWCA, we've been around for 150 years. This is our 150th year. And I think as Amber mentioned, we got through the 1918 Spanish flu, we got through the Great Depression and the Second World War. So I think a lot of what we're talking about is how do we get through the next few months, not just to survive as communities and as an organization, but also to thrive. We have 34 shelters serving women and gender diverse people and their families across the country. And we also have 2,000 units of affordable housing. So part of my job at the national office, and I'm very lucky to work with a great team, is that team and myself, we're speaking with our colleagues across the country. And because we have so many amazing service users and frontline staff and board volunteers and donors, really getting a sense of what are the boots on the ground? What are you seeing and thinking and hearing and feeling? And how do we roll that up for a coherent national strategy? I'm seeing a lot of folks jumping into the chat saying you're dreaming of travel. I totally hear you. I think many of us are, it's not until we lose the things that we take for granted. In fact, I'm very excited to do some of our site visits here in Ontario, and to travel and to go to Guelph and Peterborough and Hamilton, where I can also have a haircut after, because many of you may not know, Toronto is still officially in lockdown. They always feed the beast last. So next slide, please. So when we're talking about the gendered impacts of COVID-19 and applying a gender-based lens, my colleagues at YWCA Edmonton, along with the other Alberta YWCAs, put together a really amazing policy brief. Before I dive into the doom and gloom, I wanted to share with you just a little bit about my personal journey over the last few months. And just share a quick story with you around some of the more interesting and innovative partnerships I've seen. I've really seen Canadians step up over the last 4 months, and so wanted to also share a quick little story with you because again, it's this is meant to be the power lunch, not a disempowering lunch, and I've also seen people put in place some amazing concrete strategies. Thank you, Amber, for sending out a hug to everyone. I think we all need hugs, especially right now. So when the news first, we had started planning for COVID around late January because many of our partners, community partners, and we also get bulletins from the World Health Organization. So that's just one of the lists that we monitor to get a sense of, are there potential risks coming? But like many of you, and I love this graphic that my colleagues put on this slide because it really, to me, reminds me of the rabbit hole that I felt like I fell down when the news started to really ramp up over February and March. And falling down the rabbit hole of news, I don't know about you, but I know for myself personally, I felt unbelievably powerless and overwhelmed. And a big piece of my thinking was, can I really do this? And I think when we're talking about leadership, and especially leadership in a crisis, what are the implications? And we're not always able to predict the external threats that are coming our way. And what I needed to do personally was really sort of go back and think about my personal history and my family's history. And what sort of came to mind as I started thinking, so I'm a second generation Canadian. I'm Bengali, and one of the things that my community experienced for many years is we also saw the impacts of pandemics when India was colonized, and there were many periods of pandemics and epidemics back home because of the policies of the British. So I started thinking, and I thought, wait a minute, I'm still here. My ancestors survived through that. And I'm still here. I must be, made of some pretty tough stock. And I think especially for us as racialized community members or Indigenous, we're very well aware of the history of pandemics and how the most vulnerable in our communities suffer when it comes to a pandemic. And then I started thinking, and I thought, wait a minute, I was on the front lines of the SARS crisis. I was in Thailand when the tsunami came. I can do this. I got this. And then when I started thinking and hearing from our colleagues across the country and just the really amazing planning work that was happening, I thought, no, YWCA, we got this. We got this. We were having service users in shelters helping staff move cots 2 meters apart. We were having youth programs and frontline staff just pivot on a dime and start to move all of their operations remotely and still make sure that they're giving really important services. So one of the things I've noticed during any crisis is sort of, I think back to a number of crises that I've been a part of, is all of a sudden decision-making becomes incredibly clear. And one of the things that I heard from our member associations very quickly was, we need PPE. We need to keep our shelters and our essential services and our programs and our affordable housing going. And I thought, okay, the national office will get PPE. So prioritizing. And as you know, we've had huge shortages of supplies around the world, and it led me down a second rabbit hole. And that rabbit hole was starting to try and find N95 masks, trying to find hand sanitizer. And it led me to some very interesting, some very odd conversations, at 3 in the morning on WhatsApp with some very sketchy people telling me that they could absolutely ship masks to the YWCA, but the payment had to be up front. And I thought, really? And I think part of, when we're thinking about leadership, and especially leadership in a crisis, I realized that it wasn't just about my leadership as a person. It was about being a leader in a community of leaders, and how do we lift each other up, and how do we work together, especially that I have a lot of incredible colleagues in the YWCA movement across the country. So that was something that really struck me. And the second thing that struck me about leadership, and especially looking at the gendered impacts of COVID, was I also need to acknowledge what I don't know. And one of the things I definitely don't know is how to do international supply chain management in a pandemic with a global shortage of supplies. So this sort of leads me to, I very quickly wanted to share a quick story with you. And it was, wanted to share the story with you of the day that I ended up spending $63,000 on hand sanitizer. And you didn't mishear me, it was $63,000, 3 zeros, and I almost passed out when I put the phone down. But we realized we needed to get supplies to my colleagues really quickly. And we partnered with Global Medic, which is a really amazing organization of first responders and paramedics who are volunteers. And they actually do humanitarian aid supply drops. But we realized we just didn't have the knowledge to vet the quality of supplies. So we started working with Global Medic, and they have a warehouse. They also have an amazing relationship with FedEx. And next thing you know, they were able to help me start calling different breweries who had actually switched over, again, pivoting on a dime, on making hospital grade hand sanitizer. And it was this really interesting moment where we had an international aid organization, volunteers, private sector, and YWCA come together and find a solution. So we were able to start shipping this hand sanitizer to our shelters and YWCAs across the country. And it was really interesting because not only we were able to do this in-house, and thank you, Catherine. I remember, you tweeted out a really cute shot of you receiving the hand sanitizer, but it really showed what can come together when people actually bring their skills and expertise and assets to the table. Now, as you know, even businesses right now are struggling when it comes to cash flow, but we saw businesses and organizations step up. We were also able to ship hand sanitizer to YWCA USA. And it got to some of the most hard-hit communities in Brooklyn and Seattle and southern US. We were also able to send it to some shelters in the Arctic that weren't YWCA shelters, but just other organizations. And you're probably wondering, why is Maya sitting in her tiny apartment in downtown Toronto worried about hand sanitizer in shelters in Arctic? And that gets us to the piece around the gendered impact. We know that the most vulnerable community members are not necessarily going to have the access to supports and resources to get through a pandemic. We know, for example, that 60% of Indigenous reserves in this day and age do not have access to clean, running, drinking water. So asking people to wash their hands consistently is actually really, really unfair. And Tanya Talega actually talks about that in her book as well. So when we're talking about the gendered impacts of COVID, it's also about looking at who is the most vulnerable. What are some of the structural barriers that are in place? And how can we as a community, as a society, as an organization, start to respond to that? So I'll sort of dive in and just give you a high-level snapshot. So next slide, please. So we know that pandemics expose what's already broken in our society. And I think we're seeing that, for example, with the situation in long-term care homes. I think we're seeing that with the levels of anti-Indigenous, anti-Black racism across North America and a lot of the responses to that. We also know that COVID has hit women disproportionately hard. We know that it's predominantly women and gender diverse people who are on the front lines. And we also know that if we're not centering their needs in the decision-making process, that we're not going to recover in the way that we need to recover. So next slide, please. So just at a very high level, we know that over 70% of healthcare workers are actually women. So when I'm hitting my pot and spoon each night at 7:30, you know, that's sort of one of the things that comes to mind. We also know that about over half of women who are actually working are in the sectors that have been hit the hardest. So we talk about the 5 C's at YWCA Canada, and that's essentially cleaning, cashier, care work, catering. And the numbers for March 2020, unfortunately, are quite grim, which is you know, why I sort of shared the potentially optimistic story with you before I dived into the stats. So in March, over 60% of workers who were laid off were actually women. And even for women who were able to keep their jobs, StatsCan identified that 1.8 million actually lost hours or had their hours cut. So if you're already making minimum wage or just barely above minimum wage, as I know I don't need to tell you, that's quite problematic. And that's also where, you know, the important role of YWCA step in. And as I mentioned earlier with the hand sanitizer story, we also knew that PPE was a huge issue. So the economist Armin Yelnazayan, you know, she talks about a she-cession, not just a recession. And she's also, you know, she's introduced the term she-covery. So we're not going to be able to recover from this pandemic and the accompanying economic and political consequences without really taking women and gender diverse communities' needs into account. So that brings us to the gender-based analysis. Thank you, Christine. We also know, and I'm sure many of you are experiencing this, that as women, we have a triple burden. You know, for even many of my colleagues, I'm seeing how not only are they working full time, they are, you know, their principal, their homeroom teacher, and also worrying about elderly parents and caregiving. For all of my friends who are working parents during this time, I've just been sending them deliveries of cider and wine. Just send them a bottle of wine as a thank you, because I know what they're going through. So next slide, please. We also know that a lot of issues that tend to come up, and we've seen this on the news, for example, we started getting a lot of reports of, for example, how housing insecurity and precarity, as we already know, there's already a housing crisis in Canada. But for example, one of the things I raised with the Prime Minister's office is with an affordable housing crisis in the country, you know, in many communities, we might have 1 or 2 families sharing a 1 or 2 bedroom apartment. You know, how do you ask families to physically distance if they don't have actual physical distance? We've also seen, for example, many YWCA frontline staff over the years have spoken to me about sexual exploitation and landlords coercing women for sexual favors in exchange for rent. And so I was really concerned about that as well as the pandemic hit. And unfortunately, we have been getting reports of that. There was a group of women, for example, in St. John's, Newfoundland, and they actually started going public about their experiences in a Facebook group, and it ended up getting media attention. So unfortunately, as much as I've seen so many Canadians step up over this crisis, we also know that some people and/or structures actually take advantage of a crisis and seek to benefit from people's increasing vulnerability, precarity. One of the women from St. John's, she was talking about how as soon as her landlord heard that she had been laid off from her work, he started proposing, started to coerce her. So again, there's still a lot of work to do as we're seeing in terms of gender inequity. Next slide, please. And many YWCAs, and I'm sure you've also seen this in your own community or in your own workplace, there was a real increase in demand for services. So some YWCAs were reporting in the first few weeks anywhere between 20 to 50%. And we also know this creates a huge pressure because just like private sector organizations, it took us a while to actually transition to remote work. So we weren't able to, as we're figuring out our own tech, and we're not funded to do that as charities. So I know of organizations across Canada that are still on Windows 95, you know, when you're trying to get your entire workforce to work home remotely. That's really, really challenging. Next slide, please. So there's a couple of things to sort of think about, and you're more than welcome as a takeaway. We're happy to send this slide presentation out after, because these are also 3 questions you can use in your community or in your workplace, or if you're doing volunteer work and you want to think about, you know, how do we do a gender-based analysis? What does that mean? All these acronyms, GBA plus. And really, it's sort of asking 3 questions and centering the needs of vulnerable community members. So the first one is the speed and immediacy of response. You know, so how quickly, and as we saw in the last few months, you know, many provincial and national and even global, the announcement was made, and then the policy and the decision making is actually happening after. So I've gotten calls, you know, from Ottawa, and I really appreciate the work that our public service have been doing. But 8 o'clock on a Saturday night, you know, 7 o'clock on a Sunday morning, they're pulling together meetings because people are just sort of trying to figure out, okay, how do we respond? Asking the question around adequacy, are we doing enough? So for example, one of the questions and YWCA colleagues have been speaking about in communities across Canada, we have the CERB, that's amazing, but there's also many people who actually do not qualify for the emergency benefit. And that speaks to the third question, equity. Who are we missing? You know, who's not in the room? And if they're not in the room, why? You know, and what can we do to bring them there? So for example, you may have thought, well, Maya, you're saying who's not in the room, really it's who's not on the Zoom call. And you're absolutely correct. You know, I think we're really seeing in this crisis lack of access to internet, especially in rural and remote communities. Not only do we need it for economic recovery and prosperity, but it's, you know, access to the internet is also becoming a basic human right. Many of the YWCAs across the country started figuring out or working with local businesses in getting cell phones, so that people could have information. You know, how do you apply, even if you are eligible for a CERB benefit, how do you apply if all the libraries and Service Canada centers are closed? So in a pandemic, there's some really, really tough questions to ask. And I'd fully encourage you, as in your own communities and as you do your work or volunteer work or as board members, feel free to ask these 3 questions. And we also ask these questions internally at YWCA Canada. So next slide, please. So one of the things that the UN has been talking about is this whole notion of the shadow pandemic. And maybe just before I sort of start telling you about Sarah's story, maybe Christine, now is also a good time just to get the first poll up around sort of which COVID issue is sort of keeping you up at night. So is it about health and safety? Is it about job loss or lack of childcare? So feel free to vote. We'll give folks a minute. And also happy to talk about this in the Q&A. And I guess I should vote. So I wanted to very quickly share with you Sarah's story, and she's actually given me permission to share this with you today. She reached out to me because I was doing a lot of sort of media work, trying to get the message out and trying to get people thinking about gender-based analysis. So I got a call from Sarah, who actually grew up in the part of Ontario that I grew up in, and the domestic violence, the gender-based violence in her relationship had actually increased. She was already thinking of leaving, and then COVID hit. So all of a sudden we were in a situation where I was trying to figure out, how do I get her to a shelter? But how do I get Sarah to her shelter when she doesn't have a car? How do I get her to that shelter in a community so her and her son can be safe when public transportation has essentially been shut down or is only running once an hour? Her ex had cut off access to her phone. So literally, and no pun intended, that one lifeline that she had, she wasn't able to access data for her cell phone. And if there's one thing I would really encourage all of you to think about, is how can we do bystander intervention, especially with the second and the third wave coming. So I'm seeing here on the poll results that came up, definitely health and safety for family and friends. So just the impact in terms of on our mental health, job losses, childcare, and yes, chronic stress and impact on mental health. Look at that, 45%, absolutely. I unfortunately cannot speak to that. I have not been dealing with it well. I've been eating the entire contents of my fridge. So maybe people can give me advice during the Q&A, but absolutely. And I think part of it too is also just naming it, you know, absolutely. Thank you. So when we're talking about the shadow pandemic, there are all of these hidden layers. So for Sarah, we were finally able to get her to a shelter. And we were lucky enough that we were able to get a private sector company had stepped up and was able to give her a ride. But then we also had the issues that the courts were closed. And there were issues of getting a protection order for her. So I definitely saw how, unfortunately, the nuances of the pandemic, and especially with the lockdown, for many women, being in lockdown with your abuser is essentially a death sentence. So in terms of the shadow pandemic shareable, this was essentially something we started sharing with our members and on social media, just at a very high level summary of what we were hearing from our colleagues across the country. So for example, my colleagues in Halifax, Nova Scotia, and St. Catharines, Niagara, were also talking about the heightened danger for sex workers. Sex workers are unable to access the CERB. Obviously, you know, they won't have access to PPE. And there's obviously a lot of stigma associated with engaging in sex work. So some of the trade-offs that came from that. The threat of deportation by employer or sponsor. We were hearing from live-in caregivers. So if you're not familiar with the live-in caregiver program, newcomer women who are brought here to be nannies. So, you know, when I told you the story of Sarah in lockdown with her abuser, but for live-in caregivers, your immigration status is tied to your job. So if your employer is abusive, being threatened with deportation is also a huge threat to you. And also your job is tied to their place of residence. So we did start, unfortunately, hearing increased rates of sexual coercion, wages being clawed back. And it's very, very challenging when someone's immigration status is tied to that abusive workplace situation. So that's incredibly silencing. We've also seen live-in caregivers across the world who unfortunately passed away and because they weren't able to leave because of COVID. Unfortunately, we've also seen an increase in hate crimes across Canada. Yesterday, Angus Reid actually released a poll of Asian Canadians, and 6 out of 10 Asian Canadians indicated that they had experienced racially motivated violence. It's very challenging, especially when, you know, we have heads of state in other countries who are making racist comments. But we're also seeing, you know, for example, controlling access to essential supplies, not allowing women to access their data or their phones. So this whole idea of the shadow pandemic that sort of lurks underneath the surface is very real for those of us at YWCA. So next slide, please. So what could it potentially look like? What could coming out of this crisis? And, you know, something to keep in mind after I've just given you all of these grim stats, and you may have lost your appetite, but again, this is a power lunch, not a disempowering lunch. Something to keep in mind, I mean, this wonderful healthcare system, even with all of its flaws, that's saving us from COVID, that came out of the Great Depression. That came out of Canadians saying enough is enough. The fact that I'm going into work each day, that was because women during the Second World War, after the men came back from service, we said, nope, we like working. We get to choose whether we want to work or not. So, you know, it's a cliche, but it's a cliche because it's true. There is opportunity in crisis. So what could that look like? Next slide, please. So what we're talking about at YWCA, and again, YWCA Edmonton with the Alberta local WISE put together a really incredible policy brief and really sort of talking about what does equity look like, and what are some big picture questions we should be asking in terms of institutional sector recovery. So next slide, please. And as I mentioned earlier, this also gives us an opportunity to reimagine our future. We're in the process of doing some labor market access research right now, and the number one thing we're hearing from employers, from job seekers, from women, from YWCA staff is we need flexibility in our workplaces. And for those of you who are working parents, I'm sure you've been talking to your boss or your employer for years around workplace flexibility. COVID happens, and for many of us, they figured it out just like that, right? All of a sudden, we're zooming at home. The G20, Boris Johnson and Trump are zooming each other on calls. So I think we can see how political will is really essential. And this also gives us an opportunity. How do we center our economy on care? You know, how do we value our seniors? How do we value Indigenous and Black members of our community? So next slide. So here are some really high level points, and YWCAs across the country will actually be releasing a report soon. We're working with a number of academics, but I'll just sort of take you through some very high level pieces and also very curious sort of your feedback. So before we sort of dive into the high level, maybe now's a good time for the second poll. So for those of you at home, while you're munching away, so which policy issues do you think Canadians should prioritize? Is it about the vaccine? Is it about job creation, economic impacts? Is it around access to affordable housing? So please, I invite you to vote. So next slide, please. So one of the things that we've been talking about is this whole idea of this gender-based analysis, so essentially centering vulnerable women and gender diverse community members' needs. And one of the way that could happen is we have some infrastructure in place. So we have a Gender Budgeting Act. So by law, at least on a federal level, any financial decision is made with the woman and her children in mind. But we've also seen this at a very high level. For example, when Canada hosted the G7 a couple of years ago, we were actually, for every decision that the world leaders were talking about, there was a group of gender specialists essentially talking about and saying, okay, well, what about women? What about childcare? What about girls' education? So that's one potential way. Next slide, please. The importance of implementing reconciliation, I think, is really, really key. And what an incredible audience in terms of the poll results. Yeah, 45% indicated. So addressing the impact of COVID on vulnerable women and their families. And we know, for example, that Indigenous women are at the most vulnerable. Just since COVID has started, there have been a number of Indigenous women. When I talked earlier about, you know, staying at home, home isn't necessarily the safest place to be. More than 20 women have died. They've either been killed by their abuser, or they've been killed by police during a wellness check. So for example, Chantal Moore in New Brunswick and Regis Paquette here in Toronto, but unfortunately that's just the tip of the iceberg. So the importance of implementing the calls to truth and reconciliation and missing and murdered Indigenous, and, you know, as I talked earlier, you know, just basic things like having access to safe, running drinking water so that you can wash your hands. We've also seen across the country that as increases of domestic violence have happened across the country, we need some more creative solutions. Next slide, please. Another thing we can do, and as I mentioned earlier, if staying at home is a potential death sentence, there are some really interesting ways. So for example, at NWT YWCA, when there's a case of domestic violence, it's actually the perpetrator who's removed from the home. And there's now calls, for example, in Spain and Italy to actually do something similar, and in France. So finding some interesting and more innovative ways. And I think, I always say as a women's organization, part of our goal as a charity, if we're really going to achieve our mission of achieving gender equity, is we need to work to put ourselves out of business. So what could that potentially look like in a pandemic? I think we're also seeing, again, those systemic issues, the mass scale and response around the importance of really focusing on anti-Black and anti-Indigenous racism during COVID, and in response to the police killings of a number of Canadians and Americans. Internally at YWCA Canada, what we're trying to, and we're in the process of doing, we've actually partnered with a Black women-led organization called Women at the Center as an accountability partner. And we're doing a full internal organizational review of all of our policies, practices, and systems for anti-Black racism. So how do we do this work so that when there is a crisis, the most vulnerable are safe? Next slide, please. And care. For many of us, again, balancing childcare and workplace responsibilities. One of my friends, he gave me a great tip that he's discovered in the last 4 months after parenting and working full time. He just said to me, he said, Maya, I have no shame anymore. I let my son stay up till 11 o'clock at night, and then I let him sleep in the next morning so I can at least get half a day's work done. I said, no shame whatsoever, I think, for working parents right now during this crisis. But how do we make sure that we don't get caught off guard? And even many private sector companies are talking about centering childcare arrangements to be able to attract and retain good talent. How do we have strong public procurement policies? Because we also know women-led women entrepreneurs are more at risk of going out of business because of lack of access to credit and many other systemic barriers. So having some really clear systemic policies, especially with the second and third wave coming, is important. Next slide, please. And as I talked about earlier, decent work for all and access to paid sick leave and paid family leave. Grocery workers, personal support workers, cashiers, they are essential. They are the women that I'm giving my money to when I'm, picking up my milk or just doing my groceries. But I'm also very aware that they're putting themselves at risk and may not even have access to some of the very, very real privileges that I have as CEO. And I think we're seeing that right across the country. In Quebec, it's actually many asylum seekers who are stepping up and working in long-term care homes, but as a result, their rate of COVID, they're contracting COVID at a much higher rate and dying at a much higher rate. So, people who are newcomers or refugees shouldn't be dying at a higher rate just because we don't have the right decisions in place. I think as Canadians, we've committed to doing better. Yeah. So next slide, please. And again, as we talked about, really important to have affordable housing, to have clear transportation, especially in rural, remote, and northern communities. It's been a couple of years now since Greyhound shut down bus lines throughout the country. Not everybody has access to a car. So how do you even get to that job? How do you drop your child off at school? But what are the implications now with COVID? So again, we need to commit to doing better. And I think YWCAs are committed to pursuing some of these policies. Next slide, please. And at the end of the day, I think if we're really keeping our community members up front and center, that's really, really important. As I talked about earlier, when there's a crisis, all of a sudden decision-making is really, really clear. It's crystal clear. So here are some questions that I'd like to leave you with, and happy to sort of also talk about in the Q&A. And, you know, as we move forward, how do we use our power? How do we use our privilege? And how do we measure success so that the next time we're hit with a crisis that we're ready and prepared? Next slide, please. So thank you again. Thank you for taking the time to listen to me. And again, I'm very anxious to sort of get your questions and hear your feedback. And again, thank you again for responding to the polls.
Thank you so much, Maya, for sharing with us. That was really great. Obviously, over the last few months, it's been an unprecedented time for everyone in so many ways. And I really appreciate you highlighting, especially those pillars that will at least help to address some of the issues that have surfaced that have, like you've said, disproportionately impacted women and other marginalized groups. I also appreciate the lens that you shared around this really being an opportunity to recalibrate, reset, and maybe prepare for whatever other challenges might come at us in the future. So one of the questions that we have received to this end is around what we can do as Canadians to support this work. So how can we join in this call to action to ensure that there is a gendered response to COVID and related to recovery planning as well?
Absolutely. I mean, I think even by coming to these power lunches and being involved with Edmonton YWCA or any organization, whether, you know, I had mentioned Global Medic, but as you know, there's so many. I think all of us have potential as change makers and activists. I need to be completely candid with you. I mean, whether it's Ottawa or Washington or the UN, yes, this is unprecedented, but it's also unprecedented in the sense that we have access to information in real time. I mean, I am obsessively tracking all of your COVID rates in the 32 communities that there's YWCAs in. Maybe not a great hobby, but you know, we're able to make decisions and engage with policymakers, especially if we're privileged enough to have access to the internet, in a way that we weren't during the 1918 flu. So, you know, digitally engaging with petitions, writing to your representatives, many of the policy positions that YWCA Edmonton has talked about with their city council, reach out to your local councillor. I guarantee you every politician right now knows that they will live or die in the next election based on how they respond to this crisis. So if you contact them and if you have a need or if you're seeing something in the community, so for example, in my local neighborhood, people have been really concerned about the lack of access to mental health and harm reduction programs for street-involved community members. Obviously with COVID, a lot of things were shut down and local residents have started organizing services and support. So rather than blaming and shaming, and it's a bit embarrassing, especially, you know, downtown Toronto, maybe the richest, one of the richest cities in North America. But people have become engaged in a whole other way and in policy discussions. So I really encourage people to stay in touch with the YWCA, also sign up for the Edmonton or YWCA Canada Action Alerts. There's a lot of organizing that's all now happening digitally. And it's actually a lot easier, so you don't have to, you know, get childcare and drag yourself out to an event after a long day of work. And I would say the second thing, one of the things I've been doing a lot, there's a lot of Indigenous groups who are doing some really important discussions on Zoom right now with elders and knowledge keepers. And I've learned a lot. And it's also really helpful, for example, hearing from Senator Murray Sinclair, and him passing on traditional Indigenous teachings, you know, for example, talking about the Great Flood. So we've actually been through these crises before. And I find that notion of, okay, this is history repeating itself, we've been through it, that's actually been really comforting.
Thank you, Maya. So we have about 5 minutes left and 3 questions. So not sure if we can get to all of them, but I think that it's a reasonable goal to aspire to. So Catherine asks, which builds off of what you were just speaking about. We have seen the child care sector particularly hard hit during the pandemic. what work can be done nationally to ensure that a lack of affordable, safe childcare doesn't become a barrier for women returning to the workforce post-COVID? So I know that's an impossible question to answer in such a short time frame, but back to you, Maya.
I would say very quickly, the provinces and the federal government are talking about that because they know that we cannot have economic recovery without childcare. So again, talk to your policymakers. It is going to be very challenging even for private sector and nonprofit childcare to stay open for business. The business model just doesn't have things like PPE and hand sanitizing, built into the budget model, but definitely talk to your local representatives. Also talk to your workplace. Employers, I think, are much more open to this than they were, sadly, even 3 months ago. But for us at YWCA Canada, it's about meeting the OECD benchmark of 1% of our budget going towards childcare.
Thanks, Maya. The next question that we received talks about the shadow pandemic that you had highlighted for us. So how do we make sure that the shadow pandemic, gender-based violence, is a priority in the recovery plan?
I think, again, sort of twofold, lobby your local representatives, stay in touch with organizations and movements, because stronger, I think, we're together. Yes, I can always send snarky comments on Twitter, but whether or not that's going to be. And I think the other side to the shadow pandemic is the bystander intervention. Stay in touch with your friends, family, loved ones, neighbors. It's even in Toronto, where nobody ever makes eye contact for decades at a time. People are talking to each other. I have a friend who's going through a separation right now. I regularly FaceTime, whether with her or the kids, just to kind of keep an eye on things, because we also know that separation or divorce is one of the highest risk times. And that's one of the ways I've sort of, let's just say Auntie Maya is around a lot more on Facebook and on FaceTime. Yeah.
All right, Maya, the last question in the queue is from Danielle, and it's not as obvious an issue, but our privacy legislation, FOIP, is a huge barrier to getting information from the government about what they're doing and how they're using GBA+. I have a request in that's $5,000. Makes it nearly impossible to spread awareness in the media.
I would agree. Right now, again, we need to push and hold our policymakers and governments accountable, because right now the provinces and the feds are actually not sharing data. And the only way we're going to get through this is transparent data, obviously respecting privacy legislation. There is a contact tracing app that some governments, some provinces and territories are rolling out, and the implications of that are unknown. So I think asking exactly these kinds of tough questions are important, because the other thing too is a lot of that data in a contact tracing app is potentially being held with American companies in Silicon Valley. So how do we balance our public health needs with the fact that we need disaggregated data? We have disaggregated data for some communities, for example, people living with HIV, but what we don't have in Canada is disaggregated data and seeing who's being impacted the most. So one of the things in the States that actually is working well is they're able to see that it's predominantly African Americans who are unfortunately being targeted by the pandemic. So we need to actually adopt that model here.
Wonderful. Well, I'm just going to watch the time and wrap things up. So thank you so much, Maya, for sharing with us and taking some time with us today. It's really encouraging to know that there are women like yourself that are participating in this movement and working across all sectors and all levels, like you say. So I'm going to pass it back to Amber just to close things off.
Thank you.
Thank you. Thanks, everyone. Thanks so much, Maya. It's always a pleasure to hear you speak. I always walk away feeling like I have some structure around how maybe I can take action. So thank you for that. And on behalf of the YWCA Edmonton staff and board of directors, I'd like to thank you for participating in our Power Lunch speaker series and for all the work you do to promote the YWCA movement across Canada. My presentation has given us all a lot to think about as we ensure that women, girls, and gender diverse people are part of a successful Canadian response to COVID-19. Thanks also to our moderators, Marina Bannister and Rebecca Lee, And thank you all for joining us today. We appreciate your support. Please stay in touch and help us continue our mission of building a stronger, safer, and equitable community for everyone. Head to our website or social media channels for more information about how you can get involved or donate. Our next Power Lunch speaker series is Monday, July 6th. Our guest speaker will be best-selling award-winning author Tanya Talega. I'm really looking forward to it. Yes, yeah. I highly recommend reading that book beforehand. She will be talking about reconciliation and making a powerful call for action, justice, and a better world for all Indigenous peoples. You won't want to miss it. See you then. Have a great afternoon, everyone. Goodbye.